it's funny how life can interfere with your best plans.
Absolutely. Yeah. Yeah, but it's just one of those, it's just life, you know. It doesn't go how you plan it, but you
Never
plan your
never
life
does.
around it.
But you know what? We made it. We're here, and I'm delighted to be on your show.
Welcome to Just the Who of Us, hosted by reahhagues. This is a space for honest, thoughtful conversations around mental health, life journeys, holistic wellnesses, and the experiences that shape who we are. Take a breath, settle in, and join Rhea and today's guests as we explore the stories that connect us.
Welcome to Just the Who of Us. I'm really glad to have you here. I, I don't have a lot of conversations with medical specialists. I haven't in the past, and it's something that I am trying to change because I'm trying to gear my show a little bit more toward mental health. I have in the past, but I've also had other topics discussed too. So I really appreciate you being one of the first mental health, I'm sorry, medical specialists to come on and have a conversation with me. As we know, our mind and our body work together. Um,
Right.
I love the fact that you focus more on the holistic picture
Yes.
than, you know, just one part of the body or just one, medicine or treatment, surgery. Um, I, I've I've learned over the years to focus more on the holistic picture, and I think it's really important that we learn to do that. So, tell us a little bit about who you are and your area of expertise.
Okay. My name is Dr. Kevin Smith. I am from Pittsburgh, Pennsylvania, and I'm board certified in chiropractic and also in functional medicine and clinical nutrition. And I started my career in 2001, long time ago. And what I did, I graduated from the Palmer College of Chiropractic in Davenport, Iowa, and then I moved my family, my wife and my daughter and my dog, back to Pittsburgh, and I opened up a clinic. And I was treating the type of stuff that you normally associate going to a chiropractor for, such as back pain, neck pain, um, frozen shoulder, knee problems, foot and ankle issues, sports injuries, um, automobile accident injuries, things like that.
Mm.
And, excuse me. And sometimes people would come into the office with some weird, mysterious problem that I could not figure out what was going on, and I couldn't treat them using the tools that I was taught in chiropractic school. These are things like low thyroid disease or gut problems or brain problems, autoimmunity, high blood pressure, stuff that's outside the traditional scope of chiropractic. And that led me to wonder what is going on here with these issues and what can I do to help people. Um, they're coming to me. They've been to the medical doctors. They've tried the medications. They're still not happy with the results that they're given. And so that led me to start to attend a whole bunch of clinical nutrition seminars. And that led me to explore things like uh, metabolic testing, blood chemistry analysis, urinalysis, the ecology of the stool, saliva testing, stuff like that. And that led me into functional medicine. And so right now I'm about 50% chiropractic, 50% functional medicine, so I can reach into both worlds.
Nice.
So it depends on what the problem is. If the person has a musculoskeletal problem, that would be something involving the muscles, the joints, the ligaments, the nerves, things like that. I would use the chiropractic tools. And then if they have a problem that is more metabolic oriented, such as high blood pressure or low thyroid disease or gut problems or hormonal issues, then I would reach into the functional medicine bag of tricks for that type of stuff. So it all depends on what the person brings to me is what I will do for them.
So when I look up information on you, it lists a couple of focuses like gut health and diabetes, which was interesting to me because I thought, well, that's not something you usually think of when you think chiropractic care,
Right,
right?
right.
So it's really interesting to be able to take these other things that, like I said, when we think chiropractic care, we think our spine is, kind of the first place people go. Or, our uh working out, like you mentioned, like neck kinks and, different things. There's certain things when we think chiropractic care, that's just where our mind goes, and never to underlying issues outside of this scope. So it
Well,
was really,
a lot of people think chiropractors are back pain specialists,
yes,
and that's only partially true. We're
right.
actually nerve system specialists.
Yeah,
So our job is to make sure that the nerve system is happy and healthy, and there's nothing putting pressure on the delicate spinal nerves. Um, the difference between, say, a neurologist versus a chiropractor is that a neurologist really should be called a neuropathologist because
mm,
they deal with pathology of the nervous system, where we work on mechanical problems or making sure that there's nothing putting pressure on the nerves and that they're free to do their job correctly. That's the chiropractic thing. But as far as the functional medicine thing, that is additional postdoctoral training that I've been on for a long time. And I've been doing that for about 25 years now.
oh
I've
wow,
written two books. I regularly appear on podcasts. I have videos on YouTube. I have all kinds of stuff to try to educate people about natural things that they can do for their problems other than the the more common things, which is drug therapy. We
right,
live in a drug culture,
right,
and that drug
yes,
culture is reinforced through drug ads that you see on TV. That we all have seen them. Like, talk to your doctor to see if blankety blank drug is right for you
yes,
all the time. Uh,
yes.
the United States and New Zealand are the only two countries that drug ads are allowed on TV. No other country, you'll never see a drug ad in England. You'll never see them in Spain, Germany, Brazil, Mexico. It's not allowed in any other countries except for the United States and New Zealand. And
Wow, I didn't know that.
it
That's
just so happens
interesting.
that the United States and New Zealand have the highest cost per capita of healthcare of anywhere in the world.
Yeah. Yeah, it's as a someone who, I'm not a doctor, a chiropractor. I focus more on mental health.
Mhm.
And in my own health journey, there's been a lot of things that I've noticed, outside of the media, outside of the social aspect of quote unquote information, right?
Right.
In my own personal health journey with changing habits, having certain ailments that, medication is just, it's the first go-to. And I love my doctor, love her. But I've never had, even outside of her, I've never had a doctor, just a traditional medicine doctor, who the first thing they don't bring to you is medication. Now, my doctor does incorporate, weight loss, diet, exercise, and things like that. But regardless, the first thing that's always presented to me is medication.
So there's a reason why that's occurring. In this country, there are two predominant types of healthcare. There
Hmm.
is allopathic healthcare and there is functional medicine healthcare.
Right,
Allopathic healthcare is what the majority of medical doctors follow, where the focus is on alleviating a symptom.
right,
And what they want to do for that is they want to use a chemical usually in the form of a drug, to help you to overcome a symptom. That's it. That's the whole purpose. Whereas functional medicine, which is what I do, that they ask the question, why? Why does the person have nervousness? Why do you suffer from irritability? Why do you suffer from depression or anxiety
Right.
or brain fog, cognition issues, memory problems? Why do you have gut problems? Why do you have high blood pressure? What's going on with your body that is going on that's causing low thyroid symptoms?
Yeah.
So, in order to answer those questions, I have to put on a bit of a detective hat and uncover the hidden root cause of the problem rather than just the superficial, glossy overview of giving you a drug and hoping that that alleviates the problem or the symptom at all. People come to see me after they've been to the medical doctors and they've tried the drugs and they're still not happy with the results. Now
Right.
it's time to try something different. I'm not anti-drug. I'm not anti-doctor. I believe that there's a time and a place for all healing. So
Right.
there's a time and a place for medication. There's a time and a place for medical doctors, chiropractic, physical therapy, acupuncture, all the different healing arts, dentistry, all the different things.
Yeah.
However, I believe that as a people, we are over medicated.
Yes.
And I'm trying to do something about that. And I'm trying to educate people about things that they can do, whether it's mental health, gut health, um, your thyroid, your endocrine system, your reproductive system, whatever. There's always, just like there's more than one way to cook an egg, there's
Right.
always more than one way to fix a healthcare problem. Drugs are one solution, but it's not the only thing that's available to you.
Yes. Absolutely. Absolutely. I want to kind of shift gears just a little bit, and for any portion of the audience that's listening, that's kind of, and sometimes we know these things, but it takes someone kind of pointing it out and putting it in our face for us to say, okay, all right, I get it. It's time to do this. When, in your opinion, because also we know that every body is different, right? And, so therefore, no two people necessarily fit the same mold for treatment.
Right.
When is it the appropriate time to consult someone like you when you've haven't seen success with a traditional doctor?
That's a great question.
Thank you.
I would like to answer that. The in our culture, the number one thing that we are conditioned to do is to reach for the medicine cabinet or go to the pharmacy for an over-the-counter drug as
Yes.
the first course of action. And then if that doesn't fix the problem, then we make an appointment with the family doctor to get something stronger. And then if they can't help you, they're going to refer you out to another doctor, maybe their buddy that they play golf with down the street that specializes in that particular area, and they're going to give you a different type of a drug.
Right.
And then after that, then you're going to get a referral to go see a surgeon or a some other type of really invasive specialist. I believe that whenever you have a problem, whatever it is, whether it's your teeth or your car or a lawnmower or your house or whatever, you
Mm-hmm.
always want to start off with the most non-invasive thing you can.
Right.
You want to start off with the most gentle thing that's not toxic, it doesn't involve cutting. It's super, super, super easy and give that a chance to work. And then if it doesn't help you, then you move on to something more invasive and give that a try. And then after that, then you would try something even more invasive and go up the ladder that way.
Right.
Surgery is always the most invasive thing you could ever do in your entire body, no matter what it is. It's the most extreme uh, remedy. But there are
Yeah.
lots of things that are available to you before you go there.
Yes.
Let's say the person has knee pain. Um, you don't necessarily need knee replacement surgery as the first ditch resort. There's a lot of stuff. So, in my opinion, I think that the most non-invasive thing that you could do would be to change your diet or exercise or go to a chiropractor or go to see a physical therapist or an acupuncturist or
Yes.
a massage therapist, something that doesn't involve in putting toxic drugs into the body or cutting something or anything like that. Then, if it doesn't fix the problem to your satisfaction, then you would go into the next level of things, which may be over the counter drugs or something like that. The problem is that people have this in the wrong order. The
Yes.
first thing that they do is they reach for the medicine cabinet. That's more toxic. It's more invasive than chiropractic care. And then they go to the medical doctor for prescription strength drugs. People think that just because something is over the counter, it's perfectly harmless. And that's
Yes.
not necessarily true. The number one cause of liver death is Tylenol.
Oh,
So
wow.
all drugs have the potential of side effects, and all drugs have the potential of interactions if you take them with other types of drugs. So
Yes.
to avoid all that mess, start off by non-invasive measures first, and then work your way up the ladder.
Yes. So much so. And so I have teenagers and young adults, and one thing that I admire about them is that they don't immediately, oh, I have a headache, Tylenol. Oh, I've got a stomach ache, ibuprofen. They'll do other things. Well, did I sleep well last night? Maybe I should go take a nap. Have I drank enough water? Have I gotten any physical activity today? And which is so different from when I was growing up because I
Yeah.
was always taught Tylenol or ibuprofen for
It,
anything, right?
right. Right.
And I didn't raise them that way. It's one of the things that I was trying to change as a parent.
Well, think
And
about it this way. If you have a sick dog and you
mhm,
take the dog to the vet's going to say, what has he been eating?
that's very true.
Right?
Absolutely.
Medical doctors don't ask that question. They don't care enough about little things like clinical nutrition.
Yes.
Maybe that's the cause. Maybe you have an allergy to something that you
Yeah.
didn't realize that's going on.
Yep.
Maybe you have a chemical sensitivity to something simple like a household cleaner that you
Yes.
use to clean the dishes or your laundry, or but that can seep into your pores and potentially cause a toxic effect. Maybe you got new carpeting in your house, and the
Mm.
formaldehyde inside the carpeting causes a toxic response that
Ah,
manifests in the form of a migraine headache. So we have to look outside the box sometimes. Not just it's not enough for a lot of people just to patch your symptoms with chemicals. We want to find
yes.
out the reason what's going on.
Yeah. Yeah. I didn't even think, well, when we bought our house, I had all the carpet ripped out. I wanted no carpet. I hate
Right.
it. But we have dogs, so now I'm constantly sweeping up hair. But
Get
I
dust
just
bunnies.
like, but I didn't even think about that, things like that. We don't think about these things or
Right.
products that we use. My husband, at one point, he was buying everything all natural. And me, grew up a certain way. And I'm like, well, you're just spending more money and it just doesn't make sense. And, but
It didn't make sense at the
it
time, but when you
does.
stop to think about it, if you read the ingredients of,
Mm-hmm.
say, a bottle of Windex or a
Yeah.
bottle of Formula 409
Yep.
or some other kind of thing that you use to clean the tub or an anti-mold type of thing, does that product have the potential of causing a problem and the brain? Does it have the potential to cause endocrine disruption? Um, let's say that a female of childbearing years wants to make a family and she wants to conceive, but she is constantly bombarding her body with something that can disrupt her endocrine system and cause estrogen dominance so she cannot sustain a pregnancy for very long. Maybe that's the root cause of the issue. So, a lot of problems that people suffer with can often be traced back to very simple things that are oblivious to the medical doctor.
Yeah. Um, it's it really, like I said, some of these things are kind of when brought to our attention, it's like, oh, it makes so much sense, but we weren't necessarily taught by
Yeah,
traditional
hindsight is
medicine
always
or
20/20, isn't it?
yeah, absolutely, yeah.
Yeah.
Um, I want to ask you, oh, my screen just went blank. I'm sorry.
Well, we were talking about functional medicine, thyroid problems, and autoimmunity and stuff like that.
I had and I had I had a specific question I wanted to ask pulled up and it went away. So it's fine. Um,
You'll remember when you're driving down the highway at like
yes,
65 miles an hour going somewhere. Ah, that's what it was.
that's what I wanted to ask. Yes. Yeah, and I wanted not now, but maybe in a later conversation, to maybe have a conversation about menopause. Because I'm in perimenopause, which I knew before my doctors like confirmed it. I guess because I wasn't at the right age yet, but I had all the symptoms.
Yeah.
But if you're interested, maybe later we can have a conversation
So
more
you
get
were
in.
you concerned that it's starting off a little bit when you're a little bit younger than you thought that you should be?
Yeah, so I had a
Okay.
hysterectomy at 29.
So for a lot of gals, this is a very concerning issue.
Hmm.
And the reason why this is so prevalent in our country is because of the food that we eat.
Yes.
When you drink milk or when you eat beef or
Mm.
whatever, the people that grow those cows or whatever you're eating, they invariably will give them antibiotics to keep them from getting an infection because they keep them in such proximity to other animals.
Yeah.
Or they'll give them estrogens or growth factors to fatten them up to make them bigger so that a bigger animal leads to it's more profitable when it comes to harvesting them.
Right.
Then when you eat the beef, you're ingesting the estrogens. That's why girls start puberty at the age of 7.
Yeah.
That's why women start perimenopause by the time they're in their mid 30s. It's not natural and it's not okay to do that.
Right.
Now, from a musculoskeletal point of view, when you start perimenopause or menopause, your estrogen levels start to plummet. And
Yes.
when they start to plummet, your parathyroid glands, that are 4 glands that sit right behind your thyroid gland in your neck, what they do is they start to leach calcium out of the bones. And when that happens, that sets the stage for a disease called osteoporosis,
Yeah.
which is not curable.
Right.
So the best thing you can possibly do is to build up your bone density as much as you can, as early as you can.
Oh,
For,
okay.
for a woman, the age that your bones are the most dense is the age of 30. And then after that, they decrease and decrease and decrease and decrease every single year.
Hmm.
Also, women that are very, very petite are more prone to compression fractures or stress fractures or fractures of the hips or that old lady's hump that you get right behind your neck and your upper back.
Right.
Not only is that unsightly, nobody really wants it, but it's also very painful. And again, a lot of that has to do with the foods that we eat throughout our life. Where every time you eat a steak, if it's not a naturally raised animal, if it's injected with uh, estrogens or growth factors, things like that, you are going to be eating potentially a bad thing for you later in life. So that's what I'm talking about asking, why do you have this problem?
Mm.
What is potentially going on? Does your medical doctor ask, did you eat beef that was injected with estrogens and growth factors? They don't even
No.
consider it. It's not even a blip on the radar for them. They
Right.
just say,
Yeah.
"Oh, just take more calcium, and that's the way to fix that." That's actually not true. They find out the reason why you have uh, osteoporosis has more to do with chronic inflammation than anything else.
That does make sense.
Yeah,
Yeah. Yeah. I started having all the symptoms really in my like mid to late 30s, kind of mid 30s. And I, went and did testing. First of all, they didn't even really want to approach the idea at 35, 36. Oh, it's too early, it's too early. And at that time too, I wasn't eating as different as I do now. So I wasn't paying attention to what kind of meat I was buying, just buying whatever meat was on sale or, whatnot. And it, it's interesting because, like I said, we're not taught growing up, I guess our generation more
yeah,
so because there's so much more information available now. But when your parents don't know as well, when your grandparents didn't teach them well, you know, it takes a while to kind of catch up on information for yourself.
it
Um,
does. And you know what? All truths go through three stages. First, it's laughed at.
mm,
Second, it's violently opposed.
yeah.
And third, it's accepted as self-evident.
Um,
So where this could be true is I'll give you a story. When I was taking a break in chiropractic school between the trimesters, and I was back home visiting my mom, and I went into her refrigerator to see what foods that she didn't really pay attention to things like expiration dates, stuff like that. And so I would look at the ketchup and all that stuff that's going on and see how many years out of expiration is this, and do I need to throw this away? And there, sitting in her refrigerator, was a big tub of margarine. And I said, "You need to throw that away immediately and start eating butter." She goes, "I can't do that. My doctor told me this is much healthier than eating butter." I'm like, "Well, first of all, you need to fire your doctor immediately. And second, that you need to start eating butter. This stuff is linked to cancer. It's linked to colorectal cancer, breast cancer, all kinds of bad news.
wow.
And it's about one molecule away from being a plastic. So
Ugh.
stop eating margarine." Well, she reluctantly did, and then she found out a couple years later that trans fats are really bad. They're very pro-inflammatory, and they're linked to cancers. And butter is or margarine was one of those things that's on the trans fat
Mm,
list.
yeah.
And your grandparents or your great grandparents never ate margarine. They ate butter,
Yeah.
right? But
Yeah.
it was something that was created by the medical association, more importantly by the people that make margarine that lobbied Congress to push that stuff down everybody's throat. And that's why people were using I can't believe it's not butter and
Mm-hmm.
all these butter substitutes. Now we know better. We know that um, butter is like 1,000 times the nutritional value as margarine. But
Yeah.
I walked into that big bear trap all by myself.
We went through this kind of wave of uh, like a food wave, if you will. Because, there was a point in time where the artificial dyes, uh, all the artificial things, the hormones, all these things were not the big push. We just we grew food naturally, and then we went through, okay, well, how can we make more of this and how can we make more money off of it? And then we add all these unhealthy things. And now we're kind of coming down from this wave where we're realizing, oh, these things are bad. And we've spent the past 50 to however many years thinking that they were helping us or making things easier or better tasting or whatever the case may be. And now we're finally figuring out that, oh, all this extra is horrible.
Well, I found the only industry that I hold in higher contempt than the pharmaceutical industry is the food industry, because I believe that they are intentionally trying to kill us.
Yes.
The food industry, well, when I was growing up as a kid, I was raised in the 70s, and you didn't have peanut allergies back then. You
Yeah.
didn't have gluten sensitivity back then.
Right.
Problem is that it's not because people are exaggerating those claims.
Yeah.
It's that the food industry is meddling with the foods. They are intentionally adding more gluten to foods to make bread softer, to make cupcakes rise more, to
Hmm.
make things more palatable or more sellable to people.
Yeah.
And everything is done because of economics, not
Yes.
because of what's in your best interest or your kid's best interest or your health. They don't care at all about your health.
Absolutely.
Another example would be things like uh, big industrial size bakeries like Entenmann's. If I don't mean to pick on Entenmann's specifically, but
Right.
if you have a big multi-gazillion dollar bakery and you need to buy fats to bake your stuff, you want to make sure they don't go rancid. You want to make sure that they're going to be used in a timely fashion, and you can sell your product when you use it. So what do you do? What's going to make the most economic sense? You go and buy trans fats
Hmm.
because they're chemically treated through a process called partial dehydrogenation. And as a result, they don't spoil. So you can put them on your shelf and use them for a long, long time.
Okay.
And it makes your margins better. Makes when you sell something versus what it costs you, that's your profit margin, makes
Yeah.
it a lot more appealing. And so you're going to be responsible to your shareholders or people that invested in your company more so than the customer. And that's why all these companies, all these fast food joints, all these bakeries, they use trans fats. They know it's very, very inflammatory. It's bad for your
Right.
brain. It's bad for your gut. We talked about your major focuses of brain and gut health. You
Yeah.
got to focus on what the companies are making products with.
Yeah.
So, if it has any trans fats or partially dehydrogenated vegetable oils or corn oils or any of those seed oils, don't buy it. If it's if it's got more than five ingredients in the list, don't don't eat it. If it's got anything that you can't readily pronounce, don't
Yes.
buy it. I
Yes.
say if it's a plant, eat it. If it's made in a plant, don't eat it.
I like that.
So yeah, I got all kinds of little things like that. But when you're going grocery shopping, make sure you're walking around the periphery of the store, and
Yes.
don't go in the middle. The middle section is where they put all the bad stuff for you.
Yep.
So shop in the, but maybe 70% of everything that you buy should come from the produce aisle, and it should be if at all possible, organically grown. That means that the farmers don't spray chemicals on the crops. They don't have insecticides, they don't have herbicides. And so when you eat stuff that's been sprayed, it's going into your body. It's going to cause a problem. It's going to cause a toxic problem.
Yeah, I want to say within the process of the last 5 to 10 years, because it has been a process, but in the process of about the last 5 to 10 years, we, as in my household, my family, my husband, my kids, and myself, obviously, we have gone through this process of reshaping how we shop. And a lot of that, and we're still a work in progress. I still go through Dunkin' sometimes if I have a code to get a $2 iced coffee or, something like, I'm trying to break the habits. It's a process, but
It's hard to say no to a code for $2 off
I
iced coffee.
exactly,
My
right?
wife will attest to that. Yes.
Yeah. But and then McDonald's has the app where you can get all these cheap things and you earn points, and it's hard sometimes when you
Yeah,
are trying to be fiscally responsible, but as we also know, our holistic wellness does include our financial health as much as it does our physical and mental health.
absolutely.
Um,
Absolutely.
but the things that we started with were the when you say shopping the excuse me, shopping the perimeter,
Yeah.
it 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 is such a big game changer to the way you shop.
So,
I
so ultimately, what you're describing is your behavior,
yes,
your behavior, your consumer behavior of the
yes.
products that you feed your family and buy and stuff like that. People have said to me, "I can't afford to eat healthy; it's too expensive." And I'm like, um, I don't know if you've been to McDonald's lately, but it's not exactly cheap,
No,
or any of those fast food places. It's much more affordable to cook your own food.
it
At
is.
least you have control over what you're eating, the portion sizes, and you don't necessarily have to buy a ribeye and scallops and have that every single night. Although that would be kind of cool, but
Right.
you don't have to get um McDouble with cheese and French fries and a mixed shamrock shake either.
Right.
You can make better decisions as far as what you eat for lunch, what you eat for dinner, all that kind of stuff. And it's going to make more economic sense, which
Hmm.
is going to take a lot of stress off of your plate when your bills are cheaper.
Yeah, and another thing is too shopping locally. Shopping locally has been really important to us. So we moved from Charlotte, North Carolina to Salisbury, which is much smaller, but it kind of has
Is
a big
Salisbury in North Carolina too?
it is. Yeah.
Okay, got it.
It's about an hour away, 45 minutes or so away. And
What's
so
the closest big city to where that is?
we're not far from Winston-Salem.
Okay,
Um,
got it.
Greensboro. Are you familiar with
Yeah.
Greensboro? Yeah, we're
Yeah,
not far.
I like North Carolina. I think it's really cool to see the red dirt.
Yeah, that's what I hear. Yeah.
Yeah, exactly. My sister used to live in Raleigh Durham, a
Okay.
suburb called Cary, and that was like, oh my God, the dirt is red. It's so
Yeah.
weird, but yeah, you have a lot of options, and I'm like you. I would prefer to support a local farmer
Yeah.
rather than a
Yeah.
big corporate
Yes.
entity. So if at all possible, we're going into the time of the year that there's always farmers markets
Mm-hmm.
and there's always people that are going to be selling fresh produce right off the farm. It's better to support those people than the big companies that they don't care about you.
Absolutely. 100%. Yeah. And you're putting the money that you earn, you spend time earning this money, you're putting it back into your local community. And that is so much more important than
Absolutely.
feeding into large corporations that really don't need your money.
And
The small
by the
local
way, you can
companies do.
also support like local ranchers by buying your
Yeah,
beef and chicken and
that's a
eggs
great
from those
point.
people as well.
Yeah,
And it's better for you. The local ranchers rarely ever inject their cattle
right.
with estrogens and growth factors and stuff like that that can end up causing health issues in your own body later in life.
Right.
It's
Yep.
also a lot cheaper. So
Yes.
rather than enduring the big corporate markups for things, I would just say just find local places you can find eggs and chicken and pork and stuff like that. If you're not into hunting and fishing, then you can help a rancher out and do what you can do, right?
Absolutely. Yeah. Well, before we wrap up here, is there anything else that you would like to discuss or
Well, I would
say?
just
Or
say that to your listeners that if you like what you're hearing, and if you want to learn more about me or anything that I do, I would just go to my website. That's metabolicsolutions.net. And at metabolicsolutions.net, I have a free health quiz that you can take. It's about 2 minutes long, doesn't take very long time, and it's completely free. And you can find out more about what you're dealing with. And is it a severe problem? Is it a moderate problem? Or is it a minimal issue? And what your best next steps would be. So if you have a minimal issue, it will recommend to go check out some local websites and learn more about the problem. If you have a very severe problem, you want to go and talk to me, there's a way to get in contact with me from the contact page, and we can talk on the phone or we can do a Zoom call and we can discuss what I think is going on and what your best next steps would be to help you. But the first thing to do is to find out a little bit more about yourself by doing
yeah.
my free health quiz. And get that from metabolicsolutions.net.
Perfect. Perfect. All right. Well, thank you so much for being here today. And just I just really appreciate this conversation.
Well, thank you very much for having me. I had a great time, and I wish you well.
Thank you.
Thank you for spending this time with us on Just the Who of Us. We hope today's conversation offered reflection, comfort, or a moment of clarity. If this episode resonated with you, feel free to share it with someone who may need it. Until next time, take care of yourself and remember, you're not alone in the journey.